Welcome back to Midnight Med. This video is on a red eye. We will overview the different causes of a red eye, how it may present, and then how to manage. So the most common causes are infectious causes. There may be bacterial causes, so common organisms include Staph aureus and Streptococcus pneumoniae, or viral causes such as adenovirus or herpes simplex or varicella zoster virus, which is part of the herpes family. You can also have gonococcal causes of red eye, as well as it being purely an allergy, for example, to pollen. Now, those are some of the more common things, but it is also important to keep in mind some of the emergency and potentially serious causes of a red eye. So the most important one is acute angle closure glaucoma, as well as drug reactions such as Stevens-Johnson syndrome, periorbital cellulitis, so there's a skin infection around the eye, as well as anterior uveitis, for example, as part of an IBD syndrome. Common symptoms, so we'll go by the cause. So common bacterial symptoms include a thick mucopurulent discharge, so it's pussy, and difficulty opening eyes in the morning because you have that crusty pus over the eyes. Glaucoma is a triad of a red eye, ocular pain, as well as a blurred vision, and you're mostly thinking this is presenting in middle-aged or older patients. Viral causes also have a discharge, but it's clear and watery, so non-purulent, as well as lacrimation, so tearing of the eye. And if you're thinking extraocular causes, for example, you can have an upper respiratory tract infection associated with the preauricular lymphadenopathy and Stevens-Johnson syndrome. So that could really be a whole post on itself, but common drugs include carbamazepine, so anti-epileptics, allopurinol for gout, as well as sulfasalazine drugs or other sulfur antibiotics. Examination, so you're going to examine under different kinds of light. So under white light, you can see the pattern of redness and the discharge. For glaucoma, you're going to look at tonometry, as well as fundoscopy, gonioscopy, and perimetry, looking for raised intraocular pressures. You're looking also for any papilledema, any hemorrhage, any changed optic disc to cup ratio, as well as blurred vision. Under cobalt light, with fluorescent staining, that's good at picking up keratitis as well as corneal abrasions, other potential causes. It's mainly a clinical diagnosis, especially for infectious causes, but you could swab them. And management, so infectious causes are largely supportive, so any analgesia and making sure their fluids and electrolytes are okay. But you can consider topical antibiotics such as erythromycin. Glaucoma definitely needs medical management, so it's not supportive. In an emergency, you're going to give cholinergics, the pilocarpine 2%, beta blockers, beta-toxol, and carbonic anhydrous. And these all help reduce the intraocular pressure by either increasing outflow or decreasing inflow. Surgical can also be a laser peripheral iridectomy, and that also affects the intraocular pressure and outflow through the aqueous humor. Thank you for watching. I hope you learned something. If you did, please tell a friend who may also find it useful.